Adenomyosis. What is it and treatment? So maybe you have heavy and or painful periods and you're not sure what's going on. Did you realize that two symptoms of adenomyosis is actually heavy and painful periods? Perhaps you've already been diagnosed with adenomyosis. And you'd like to know what adenomyosis actually is and what are some natural treatment options for you as well. So let's talk about adenomyosis, what it is, and the natural treatment. So hello everyone, I am so thrilled to be here. For those of you that don't know me, my name is Michelle Cooke, period and hormone naturopath, natural fertility educator, and naturopathic emotional release practitioner. And I help women struggling with their menstrual cycles have easy, pain-free periods, balanced hormones, and emotional well-being. And I run a clinic located in Melbourne, and I see patients both online and face-to-face. So if you have any questions or comments as we go through the live today, be sure to pop them in the comments box down below. Or if you're a bit shy, I can always answer those for you later. I'd be more than happy to do that. If you're enjoying the content as well, be sure to hit the likes and loves as we go through, just so I don't feel like I'm just talking to a screen, and I know that you're enjoying the content as well. So what is adenomyosis? So basically, adenomyosis is when the endometrium, or the lining of the uterus, has lesions that are growing in between that muscular wall of that uterus there, or the myometrium, that's sort of the technical term. And they're known as adenomyosis lesions. So there is muscle hyperplasia there as well, which basically means that the uterine muscle or uterine wall will kind of enlarge because of those lesions that are growing in between that muscular wall of the uterus. And there can also be destruction to that normal myometrium or muscular wall as well. So there's lesions inside the uterine muscle wall, and they bleed when you have your period as well. So that causes a lot of pain and inflammation. So each time you have your period, those lesions within that, within the muscular wall of the uterus are also bleeding as well in response to the hormones and the stimulation that occurs to make you have your period. So that causes a lot of problems. And the prevalence is really difficult to ascertain because there are asymptomatic types of adenomyosis. So that's when there's actually no symptoms occurring. One study had a rough estimate of around 20 to 30% of women experiencing adenomyosis, and that's based on ultrasound diagnosis. And it's highly dependent on the age group as well, so it can really vary from age group to age group. Another study used MRI to diagnose in women, that were less than 42 years old, to try and diagnose adenomyosis that way. And it was actually present in about 59% of women, or technically 59.9% in that particular study. So see how it can really vary there. It's sort of difficult to ascertain. But it is a high percentage of women that actually experience this or have adenomyosis. So symptoms of adenomyosis are things like heavy periods, which is known as menorrhagia. That's the technical medical term. There can be long periods. There can be intermenstrual bleeding. So prior to the period, after your period, around ovulation, after sex as well. There can be pelvic pain. painful periods as well, which is known as dysmenorrhea. That's the sort of medical terminology. There can also be blood clots during your period as well, and these are rather large too. There can be painful sex, which is known as dyspareunia, which is the medical terminology. And there can be approximately 30% of women that can actually be asymptomatic. So they actually don't have any symptoms at all. So how is adenomyosis actually diagnosed? Well, it's usually diagnosed via ultrasound or MRI. So the technology is getting better and better, but generally it will be a transvaginal sort of pelvic ultrasound or an MRI of that pelvic region as well. And they may see things like, the uterus might appear sort of enlarged or bulky in some areas. They may be able to see indication of those lesions throughout that muscular wall as well, or they may see cysts. As we go through, you realize there's kind of lots of different types and subtypes of adenomyosis as well, so we'll discuss those as well. So risk factors. So some of the risk factors could be prior pregnancies. So, you may have had a pregnancy or birth prior, or you may have had kids. This can increase the risk. However, it has also been found in women that haven't actually given birth at all. So nulliparous, they haven't had any children. Other risk factors can include miscarriage, voluntary pregnancy terminations. There can be, another risk can be uterine surgery as well. So any type of surgery in that sort of uterine space or pelvic cavity. So that can include things like cesareans as well. However, it has been found in women that haven't had any type of uterine surgery done as well. So keep that in mind. Also increased age. However, it's also been known to show up in younger women as well. So please don't take these risk factors as gospel. Some of them may apply, some may not. Also, having endometriosis can increase the risk of having adenomyosis, and similarly with uterine fibroids as well, there can be an increased risk of that occurring there too. Now, just a note on endometriosis. So, adenomyosis and endometriosis will often coexist together, but not always, but they can. So, the estimated prevalence of having adenomyosis when you have endometriosis is really variable, and lots of research papers are differing in their views and opinions. However, in one research paper, the prevalence of women with endometriosis also having adenomyosis was 80 to 90%. So quite a large amount of women in that study had both of those coexisting together. Similar to another author who found that there was more than 90% of patients having adenomyosis along with endometriosis. And there was a further study that suggested that less than half of the endometriosis patients had adenomyosis. So very varied, isn't it, in the amount of those conditions coexisting together. And there was another paper that suggested there was actually no relationship between the two. So very, very interesting. There's still lots to be learned in respect to that. So just a note on uterine fibroids. So adenomyosis and fibroids can frequently coexist together as well, but not always. So let's talk about the types of adenomyosis, and there's many different classifications of adenomyosis. So one type of classification is this. So there can be focal adenomyosis. So that's when the lesions are actually, well, there's two types in amongst this. So one is that the lesions are not encased. They're just kind of free forming. And this can be where there's more than 25% of the circumference of the lesion is surrounded by normal myometrium, or the muscular wall of the uterus. So this is a fairly small congregation of them compared to some of the other types. Then amongst that, in amongst that focal adenomyosis, there can be lesions that are clearly encased, and the myometrium is hypertrophic, so it's enlarged. And it's known as adenomyoma. So they're actually, the lesions are in this little casing, so that's an adenomyoma. And again, it's still a focal adenomyosis, so more than 25% of the circumference of the lesion is surrounded by a normal myometrium or uterine wall there. Then there can be diffuse adenomyosis, so that's when diffuse, that's indicating that there's more of those lesions there. So obviously there's going to be less sort of normal muscular wall surrounding that. So this is when there's less than 25% of that lesion being surrounded by normal healthy myometrium or muscular wall of that uterus. Then there can be a mixed type of adenomyosis. So that can be a mix of focal and diffuse. So there can be, little clusters of them, or it can be a bit more widely spread. That's the mixed type. And then it needs to be determined whether it's actually cystic. So does it contain cysts in amongst that as well? Or are there no cysts? So that's known as non-cystic. Then we need to determine, well, where is it in the uterine muscular wall? Is it in the inner myometrium? So that's closest to the endometrium or the lining of the uterus. Is it in the middle myometrium, so in the middle of that muscular wall? Or is it in the outer myometrium, which is the subserosa kind of area? And how bad is it? So there's different varying degrees. There's mild, which is when there's less than 25% there, or there can be moderate, so that's about 25 to 50%. And there can be severe, where there's greater than 50% of adenomyosis in that myometrium. So what causes adenomyosis? They're still learning. They don't know enough, okay? There's a lot of theories out there, but there's nothing kind of substantial to kind of point out for you. So still a bit to be learnt in that regard. So let's talk about natural remedies for adenomyosis then. And we need to remember that these are just suggestions to help ease some of the symptoms that you may experience, but it's not a complete solution, because ultimately it's best to see a naturopath that specializes in periods and hormones to get down to the bottom of what's going on for you. What are those underlying causes and drivers and things that are causing that endometriosis to be there in the first place? So just keep that in mind. So these are just general suggestions. So one of them is to increase omega-3 in the diet. Really, really important. So omega-3 is anti-inflammatory. It will help reduce inflammation and pain associated with adenomyosis. So, the period pain and inflammation and discomfort, etc. So including things like oily fish, so mackerel, sardines, and salmon are really high sources of omega-3, and they're lower in mercury levels, so best to kind of go for that. There are plant sources as well, so things like chia seeds and hemp seeds, but just keep in mind that fish is probably the best source of omega-3, because a lot of plant sources also contain omega-6, and they're usually predominantly high in that, but not so much in omega-3. So really fish is where it's at. That's what you've got to be including. Another good tip is to have an Epsom salt bath. So Epsom salts contain magnesium sulfate, which is amazing. So if you have a warm bath and you pour about 500 grams of that Epsom salt into the bath, that will be beneficial for relaxing your muscles. It's a muscle relaxant, magnesium is specifically. So if you think about it, your uterus has a muscular wall, right? So it's going to help relax that as well. So it's going to help with uterine spasm, cramps, period pain, and all those kind of things. So that's a really nice thing that you can do as well. Another good thing that you can do is include rosemary in your diet. So rosemary will actually help with phase 2 liver detoxification, and it makes those toxins more water soluble so that they can be excreted through the body via wee and poo essentially. So it's just making it kind of less toxic on the way out. And we need to remember that supporting phase 2 liver detox is very, very important for estrogen balance in the body and hormone balance, because the liver's role is to break down hormones after they've done their job in their body, break them down and safely remove them from the body once they've done their job. So that's really, really important. So you can either have this in your food, so you can sprinkle it into salads, or you can have it on roast vegetables, for example, or you can have it as a tea. And it is rather strong in its taste, so you could actually mix that with other herbs as well, or other teas that are organic preferably, just to help with the taste and make it a bit more palatable. So that's 3 suggestions there that you can try to help with the inflammation and the pain. So it's kind of more targeting the symptoms, but it's not really getting down to the nitty-gritty and the causes of that. So just keep that in mind. So can a naturopath help with adenomyosis? So the answer is yes, absolutely. And particularly one that specializes in periods and hormones like myself. It's very, very important, as I said, to get down to the bottom of what are the contributing factors and the drivers in terms of your adenomyosis. What's happening there, And perhaps you've got heavy and painful periods, or maybe you suspect you might have adenomyosis, but you're not sure. Or maybe you actually have been diagnosed with adenomyosis. Either way, I'm more than happy to help you in this regard. So treatment-wise, we would be looking at things like natural medicine, so including things like herbal medicine, nutritional medicine, diet and lifestyle advice, based on pathology signs, symptoms, what's going on for you. Diet and lifestyle as well we incorporate too. And I also use naturopathic emotional release. So this is working on any underlying emotions or stressors in respect to a physical thing you might be presenting with. So including adenomyosis, sort of looking at if there's any underlying emotions there, because that's very important to look at as well, not just the physical. So the treatment aims really depend on your individual presentation, but generally speaking, it would include things like this. So reducing inflammation, and we can do that through lifestyle advice, dietary advice. Natural medicines work really well here too, so nutritional medicine, herbal medicine, for example. And hormone balance and support as well. So particularly your estrogen and progesterone ratio, looking at that, making sure that that's balanced. And that can be assisted through diet and lifestyle, nutritional medicine, herbal medicine. So again, same. Management of estrogen levels as well. This is really, really important, because high estrogen levels, estrogen dominance or estrogen excess, or too much estrogen relative to progesterone can actually drive and worsen the symptoms of adenomyosis. So it's important to get that under control. So some good strategies would be to support good liver function. So making sure that your liver is working properly and it's breaking down your hormones effectively and it's being cleared through the body through that phase 2 detoxification and phase 1 as well. Good bowel function, so making sure that you're doing a poo every single day, at least once a day, and making sure that you're not constipated, and all those kind of things is extremely important, because we need to make sure that there's a way out for that estrogen. Otherwise, it's going to be reabsorbed back into the body, and it's going to cause a lot of issues, inflammation, period pain, and it's going to contribute to that adenomyosis. Another factor is gut health. Really, really, really important. And I mean, the same goes for any type of reproductive health condition. You always need to look at the gut, what's happening there, because there's gut bacteria specific to managing estrogen, which is known as the estrobolome. So that will regulate estrogen levels. If there's any gut dysbiosis there, so if there's an imbalance of gut bacteria, whether it be, an overgrowth of bad bacteria, or perhaps there's an overgrowth of good bacteria, which is known as commensal. But with that overgrowth, that still causes an imbalance, and it causes issues there. And the other thing to consider is not only is estrogen management very important in terms of that gut bacteria, but also there's some bacteria that produce endotoxins, which is known as LPS, or lipopolysaccharides. These cause a lot of inflammation and pain, and there's been a lot of research now to suggest that they actually travel from your gut into the bloodstream and then onto and into that pelvic region. So where your uterus is and your ovaries, etc., it's traveling there, and it's causing more inflammation at the uterus, at the ovaries, etc. So it's contributing to those conditions like adenomyosis, endometriosis, fibroids, all those kind of things. So it's really, really important to make sure that your bacteria is in good balance. Otherwise, it will contribute to those nasty symptoms. Now, assessment. So in terms of assessment, we'd be looking at things like nutritional deficiencies, because there's particular nutrients, if you're deficient in them, they can contribute to period pain and heavy periods and all that kind of thing. So it's important to be looking at those through pathology testing. Hormone balance as well, so looking at girly hormones, so estrogen, progesterone, testosterone, all those kind of things, but not just them, also looking at your thyroid function, because all the different glands in the body interact with each other. It's not always going to be about the ovaries, it's about what's happening with other organs too, and how are they actually influencing the symptoms that you're experiencing. So we usually do pathology testing to look at, all of your girly hormones, your thyroid hormones, your pancreatic hormones as well, because high insulin and high glucose, for example, can cause inflammation in the body. This will cause hormone imbalance. It will contribute to period pain and all those kind of things. So very important to get that under control too. And also looking at your adrenal function too, because stress plays a huge role in terms of hormone balance in the body. So it's important to make sure that your adrenal glands are happy. And also looking at gut health as well. So this may include things like going for a microbiome test, which looks at what kind of bacteria is in your large bowel. Is there bad bacteria there? Is it at high levels? Do you have enough good bacteria? Is it at low levels? Is it at high levels? Because either way, it can cause a lot of problems, especially where periods are concerned. The other test might include, and this is only relevant if you've got symptoms associated with it, but it may include testing for SIBO, so small intestinal bowel overgrowth. This is actually looking at your small intestine to see if there's bad bacteria there. So it's measuring gases in the body that are produced by that overgrowth of bad bacteria. So it's measuring hydrogen and it's measuring methane. So looking at both of those, because they can actually contribute to histamine in the body or histamine production, so too much histamine, and it contributes to period pain as well. So really, really important to look at that. Is there any questions so far? I'm just going to have a double check. Not so far. All good. Okay. So if you would like any support with heavy periods or painful periods, or you've got adenomyosis, I would absolutely love to help you. So please reach out and book a free discovery call so that we can talk about what's going on for you, whether we're a good fit, and actually what would be involved treatment wise. So on Instagram, I actually have a link in my bio so you can book it there. If you're watching on Facebook or Instagram, I will pop a link down below for you to book for that. And remember that all my Instagram and Facebook lives are actually on my website. So if you've missed any past ones, or you can't be bothered sort of scrolling through to see what I've done in the past, just be sure to go on there. So if you head to reproductivewellness.com.au/blog, they'll all be there. There's the video at the top, and I've written all the text underneath as well. So if you're more of a visual learner, you have that there too. There's a link in my bio and Instagram for that as well, for the blogs. So yeah, make sure you check that out. And I would like to thank you so very much for watching this evening. I really appreciate you. And I love educating people about, women's health and all that kind of thing. It's very, very important for us to be knowing about this and to be educated and empowered. So if you're watching on my YouTube channel, be sure to like and subscribe. And FYI, I go live every Wednesday, 6:30 p.m. Australian Eastern Standard Time, discussing things about periods, hormones, menstrual cycles, and women's health. So I very much look forward to seeing you next week, and I hope you have a lovely rest of the week. Thank you so much for listening. Bye.